Let us now talk about exercise capacity. Tests are sometimes needed to measure your heart function, lung function, and blood circulation in response to exercise. They're often used before a major operation, especially to your chest and abdomen, or if you have an unexplained breathlessness or chest pain, and other tests have been normal. During cardiopulmonary exercise testing, you are instructed to sit on a stationary bicycle. As you pedal, resistance is increased gradually from zero so that the exercise intensifies. The test can also be done with a treadmill. The results are compared to those expected for someone of your age, sex, and weight. A result lower than expected suggests your fitness is low. This helps your clinician decide whether the proposed surgery is safe. Alternatively, the spirometry, ECG, and oximetry data may identify the cause of your symptoms. Other forms of exercise capacity tests include the 6-minute walk, in which you walk between the two cones and your heart rate and oxygen saturation are monitored. In a variation called the shuttle test, you are asked to walk faster each time until you reach your limit. In cardiopulmonary exercise testing, you are given a mouthpiece, which measures how much air you breathe. Chest electrodes record your ECG, and an oximeter on your finger records oxygen saturation. Thank you for your attention.
Phlegm often harbors stasis. After it has been formed, phlegm follows qi and blood. It is in the interior in the internal organs and in the exterior in the channels. Because it obstructs, it may give rise to the aggravate blood stasis, also because of the interaction between fluids and blood. In fact, on the other hand, there is a relationship of modal exchange between body fluids and blood, and therefore blood stasis affects the fluids. On the other hand, phlegm is an accumulation of pathological fluids and it therefore aggravates blood stasis. However, just the phlegm may aggravate blood stasis. The latter may also contribute to the former due to the interaction between fluids and blood. Thus, the two reinforce each other and establish a vicious circle. Interaction between phlegm and blood stasis. But Xu Dan Shi says, when the lungs are distended and there is a cough and the patient cannot lie down, it is due to phlegm harboring blood stasis. Zhang Lu says, phlegm harbors dead blood. It follows qi to attack, it flows and causes pain. Li Yong Kui says, blood in the stomach may stagnate it with accumulation of phlegm day and night. It leads to the disease of Yuji and Fan Wei. Many of the diseases of Western medicine are considered to be due to phlegm and blood stasis, such as lymphoma, cancer, brain hemorrhage, coronary heart disease, and some mental illness. The interaction between phlegm and blood stasis may cause the following manifestations: dark nails, dark complexion, purple lips, purple and swollen tongue, dark rings under the eyes. Thank you for your attention.
Okay, good day everyone. Today we'll talk about foot yang mi, stomach meridian, stomach 18, jukan, root of the breast. As we can see the illustration for stomach 18, jukan, at fifth intercostal space, fortune lateral to the anterior median line of the chest. Stomach 18, Juken, root of the breast root, hemp breathing. Needling, 0.5, 0.8 kun, obliquely or transversely, subcutaneously, parallel to the course of the intercostal space or with or against the channel pathway. Caution, pneumothorax. Actions and indications, benefits of the breasts, moves the blood, unbinds the chest, regulates the lung chi, mastitis, lactation, lumps and discomfort in the breast, premenstrual swelling, and can be indicated when the breast is exhausted and unable to produce sufficient milk. Juken, stomach 18, is the principal local point for treating disorders of the breast. According to Zhu Danqi of the Jingyuan dynasty, the breasts are where the yang ming passes, and the nipples are ascribed as the julian. Disharmony of the stomach, yang ming or liver julian channels is therefore involved in all breast disorders. Since Juken, stomach 18 regulates the qi and blood of the breast area as a whole, it may be used for any excess-type breast disorder characterized by pain, distension, swelling, or abscess, whether due to stomach fire or oppression and a stagnation of liver qi, were the two main excess interior pathological factors in breast disease. Nursing mothers are particularly prone to breast disorders. Zhu Danqi went on to say, if the breastfeeding mother has thick flavored food or bears indignation or grudges, she will therefore stop circulating and the portals will become blocked. Because milk is no longer able to come out, the blood of the yang ming becomes hot and transforms into pus, as well as breast abscess due to the internal factors. Juken, stomach 18, is also indicated when exposure of the breast to exterior pathogenic factors, improper suckling, or even, according to Zhu Danqi, the burning hot breath of the newborn baby blowing onto the breast lead to heat, stagnation, and swelling. As far as scanty lactation is concerned, this is most commonly due to stagnation of liver qi, resulting in failure of free flow or to insufficiency of qi and blood, mainly due to deficiency of the stomach and spleen. Juken, stomach 18, is indicated whatever the pattern. According to the great compendium of acupuncture and moxibustion, Juken, stomach 18, is recommended for pain of the chest, diaphragm qi. This refers to oppression of the chest with shortness of breath due to stagnation of liver qi. Juken, stomach 18, may also be used more widely for cough or asthma. Finally, according to the Ode of Qi Hong, Juken, stomach 18, may be used to promote and hasten labor, although it is not traditionally contraindicated in pregnancy. Thank you for your attention.
Let's discuss damp heat in the liver and gallbladder. This is due to damp heat accumulating in the liver and gallbladder, impeding the smooth flow of qi. It is seen in the middle jiao level of the Sanjiao patterns. This pattern can lead to liver and gallbladder damp heat accumulating and congealing. Key symptoms: distending pain in the right hypochondrium, anorexia, abdominal distension, jaundice, which is a yellowish color of the skin and sclera of the eyes, vaginal itching, and signs of a damp heat pattern. This pattern is due to invasion of pathogenic damp heat or excessive consumption of warm, fatty, or greasy, or sweet foods which produce dampness and heat, or spleen deficiency causing the formation of dampness, which then turns into heat, followed by earth, insulting wood, all of which lead to damp heat accumulating in the liver and gallbladder. Here we have the analysis of damp heat in the liver and gallbladder. If the smooth flow of qi is impeded, qi does not flow freely, resulting in distending and burning pain in the right hypochondrium. Impeding the smooth flow of qi can also bring about gallbladder qi rising, leading to bitter taste in the mouth. Impeding the smooth flow of qi will result in the outward overflow of bile, and this will lead to jaundice, which is an orange peel color. Damp heat pathogen in the Shaoyang channel will result to alternating chills and fever. When liver qi invades the spleen and stomach, abdominal distension, irregular defecations, this will lead to anorexia, nausea, and vomiting. Damp heat infusing downwards along the channel will lead to yellow and foul leukorrhea, vaginal itching, and in males, scrotal eczema, redness and swelling of the testes, and scanty dark urine. Tongue will be red with a yellow greasy coating, wiry and rapid or slippery and rapid pulse. All of this are signs of a damp heat pattern. Treatment principle: drain damp heat from the liver and gallbladder. We choose from liver 2, 14, bladder 18, 19, gallbladder 24, 34, 41, Sanjiao 5, Danang Shui, Li 11, spleen 6, and Du 9. Little technique is draining. Liver 2, 14, GB 24, 34, bladder 18, 19, and Du 9 drain damp heat from the liver and gallbladder. GB 41 and Sanjiao 5 together open daimai and drain damp heat. Spleen 6 and 9 will drain dampness. Li 11 drains damp heat. Danang Shui is an empirical point for the treatment of gallbladder disorders. When there is damp heat in the liver and gallbladder, the patient should avoid consuming substances that create heat or dampness, especially if these substances have an affinity with the liver. Alcohol, hot spices, fried food, and too much red meat should particularly be avoided, as well as foods such as dairy products, sugar, sweets, nuts, bananas, and avocados. A liver that is burdened by pharmaceutical medicine, alcohol, chemicals, heavy metals, and other pollutants will have difficulty carrying out its metabolic functions. So caution should be exercised, and the consumption of all kinds of medicine, including dietary supplements and herbal remedies, should be limited as much as possible. Stress and pent-up emotion, especially anger and frustration, can create heat in the liver. A person with damp heat in the liver and gallbladder should try and address these emotional issues. Exercise, sport, and physical training will be beneficial, as physical activity will help to circulate and spread stagnant liver qi, which is often involved in the creation of heat in the liver. Thank you so much for listening.
Let's now go to inquiring. Let's discuss common symptoms in internal medicine, part 2. Common symptoms in internal medicine. Cough. Cough is the main symptom of lung illnesses, and it's mostly due to failure of lung qi to move freely. Clinically, there are two categories: that due to exogenous illness and that due to internal injury. Cough accompanied by cold intolerance, fever, and a floating pulse is due to an exogenous illness, such as wind cold binding the lung, wind heat attacking the lung, or dampness damaging the lung. Chronic cough without the symptoms of exogenous illnesses is due to internal injury, such as deficiency of lung qi, deficiency of lung yin, or phlegm dampness blocking the lung. For the right flank distension, this occurs mainly in liver or gallbladder diseases. If accompanied by agitation and irascibility, ready saying, and a taut pulse is due to trapping of liver qi. If accompanied by jaundice, a red tongue with yellow and greasy coating and a taut and a slippery pulse is due to dampness heat in the liver and gallbladder. For abdominal distension, if the distension comes and goes and is eased by pressure, it is due to insufficiency of the spleen and the stomach. If the distension is not reduced by pressure and is accompanied by a white and greasy tongue coating, it is due to strong cold dampness in the interior. If the distension is worsened by pressure and is accompanied by foul eructation and acid regurgitation, it is due to food retention in the stomach. For barbarigmus, this may be seen in deficiency of spleen and stomach qi, deficiency of spleen yang, deficiency of kidney yang, strong cold dampness in the interior, and disharmony between the liver and the spleen. The mechanism is unbalanced action is of qi causing dysfunction of the large intestine. For edema, in diagnosing the cause of edema, first distinguish between yin edema and yang edema. The yang edema, this is edema due to strength illnesses caused by exogenous pathogenic evils. The mechanism is retention of water or dampness due to the lung losing its dispersion and depuration functions. The clinical characteristics of yang edema are as follows. The edema starts in the face, then extends to the entire body surface, but worse in the upper body. The skin is glossy, and the urination is difficult. The edema is often accompanied by symptoms of the exterior, cold intolerance, fever, and a floating pulse. The edema of acute glomerulonephritis, inflammation of glomeruli of the kidney, is a type of yang edema. For yin edema, this is edema due to illnesses of deficiency. The usual mechanism is deficiency of the yang qi of the spleen and kidney, so that these organs are unable to transport, transform, and control fluids, but allow fluids to overflow into the superficies. The clinical characteristics of yin edema are as follows. Edema are more pronounced below the waist, pressure-induced depression in an area of edema persisting after removal of pressure or pitting edema, distension in the epigastrium and abdomen, and anorexia and loose feces. Alternately, there may be lumbar and knee aches and weakness, cold aversion and cold limbs, a plump and pale tongue, and a deep, slow, and a weak pulse. The edema of chronic glomerulonephritis, chronic kidney insufficiency, or heart failure is often of this type. Thank you for your attention.
Let's now proceed to review of systems under comprehensive health history. The last component of the health history is the review of systems, during which the clinician questions the patient about whether or not she or he has experienced symptoms that may indicate possible pathology in one or more body systems. The nature and depth of the questioning are determined by the reason for which the patient is seeking care, the chief complaint, as well as the severity of the condition if she or he presents with an acute problem. Types of reviews of systems. In a non-emergent primary care setting, the review of systems follows one of two forms, comprehensive or focused. The comprehensive ROS is conducted when a patient presents for general health maintenance, disease prevention care. The provider asks general questions that are designed to identify if the patient is experiencing symptoms that may suggest an actual or potential problem in one or more body systems. Questioning covers all body systems. Before examining the key questions to be asked for each of the body systems, there are important concepts to note: significant or pertinent positives and significant or pertinent negatives. Disease states usually produce a cluster of symptoms. However, some are considered to be more indicative of a particular condition than others. For example, chest pain is strongly associated with cardiac disease, although it may also occur with gastrointestinal and musculoskeletal disorders. The questions commonly included in a comprehensive ROS are those to which a positive response suggests the existence of pathology in a given system. Thus, when a patient responds that he or she has experienced a symptom about which he or she is being questioned, that is considered to be a significant positive response. When such a response is given during the comprehensive ROS, the clinician will then ask additional questions to better describe the characteristics of the symptom and to determine the presence or absence and description of any associated symptoms. For example, if a patient acknowledges that she or he has experienced chest pain, the clinician will probe further to obtain a full description of the pain. PQRST, the provider would ask questions about the presence or absence of radiation of the pain to the left arm, jaw, or area between the shoulder blades, and about precipitating and alleviating factors. For example, if the pain was brought on by exertion or emotional excitement, distress, if it subsided with rest. The provider would ask the patient about the coexistence of associated symptoms, such as nausea or sweating, diaphoresis. If the patient acknowledged experiencing additional symptoms of nausea and diaphoresis during episodes of chest pain, these would be considered to be other significant positives in that they tend to confirm that the pain is of cardiac origin. In contrast, negative responses to questioning about these associated symptoms would be considered to be significant negatives because the absence of these symptoms decreases the likelihood that the patient's chest pain is cardiac in nature. Eliciting and recording significant positives and negatives are essential to developing sound differential diagnosis and to assessing the potential severity of the patient's symptoms. Focused ROS is conducted when the patient presents with a specific chief complaint. Questioning would be directed toward the systems most likely to be involved in producing the patient's symptoms. The patient would not be questioned about symptoms in the remaining body systems. For example, if a patient presented with a sore throat and a sensation of pain and pressure below both eyes, the clinician would ask problem-specific questions about the head and neck, including the eyes, nose, mouth, and throat, sinuses, lymph glands, and respiratory system. Thank you for your attention.
Let's now go to acupuncture for emergencies. Let's discuss stroke in clinical manifestations. The principal and characteristic features of stroke are loss of consciousness, hemiplegia, numbness, dysphagia or aphasia, and dry mouth and tongue. In addition, there may be dizziness, headache, vomiting, agitation, convulsion, much sputum, hiccup, and incontinence of both urine and feces. The pupils may be dilated or constricted. The tongue may be stiff, wry, or curled. It may be cyanotic, red, or crimson, and it may be speckled with petechia. The tongue coating may be thin and white and greasy, yellow and greasy. The pulse is mostly taut, but may be slippery and thread-like, hesitant or intermittent. The stroke may be preceded by an aura, usual dizziness, headache, tinnitus, speech difficulty, or numbness in the limbs. For loss of consciousness, in mild cases, there may be mental confusion or somnolence. In severe cases, there is loss of consciousness or coma. The patient may fall into coma from the outset or may be mentally clear at first but gradually fall into coma with delirium and agitation along the way. For paralysis, this may be hemiplegia or paralysis in only one limb. In mild cases, the affected part is merely weak or poorly controlled. In severe cases, it is complete paralysis, often with anesthesia. During the acute phase, the affected limbs are usually flaccid, but a small portion of patients may have clonic or tonic tetany. In later stages, the affected limbs may have stiffness or contracture, especially in the joints of the fingers. For the mouth and tongue, These may be wry with deviation toward the side of hemiplegia. This is often accompanied by excessive salivation. And lastly, for speech. In mild cases, speech may be slow or slurred, with a sensation of stiffness in the tongue. In severe cases, there is aphasia. Thank you for your attention.
Erectile dysfunction, heart and kidneys not communicating, heart and kidney G deficiency, clinical manifestations, impotence, premature ejaculation, dizziness, tinnitus, palpitations, lower back ache, depression, pale face. Tongue is pale, pulse is deep and weak. Treatment principle, tonify kidney and heart Qi and calm the mind. Points, Heart 7, Shenmen, Heart 5, Tongli, Bladder 15, Shinshu, Kidney 7, Fuyu, Kidney 3, Taishi, Bladder 23, Ren 4, Ren 15, Do 24, Do 20, Small Intestine 3, Bladder 62, with all with reinforcing method. Explanation in acupuncture. Heart 7, Heart 5, and Bladder 15 tonify the heart. Kidney 7, Kidney 3, Bladder 23, and Ren 4 tonifies the kidneys. Ren 15 and Do 24 calm the mind. Do 20 lifts Qi. Small intestine 3 with Bladder 62 open and regulate the governing vessel. Thank you for your attention.